What's up guys, welcome back to the channel. Mark Stock Review. Hope you're doing well today so far. This video is going to be on Jaguar Health. I'm going to show you my positions first, then go over a very brief overview of the company. I'm also going to go over near-term catalysts to keep an eye out for, and finally some risks. And as usual, I'll keep my video informative but brief as possible because I know your time is valuable, so a thumbs up and subscribing if you haven't already would be greatly appreciated. That said, let's get right into it. And full disclosure, as of the time of this recording, I do not currently own Jaguar Health. I did list some of my other positions here for you to see with their cost basis for your reference. Jaguar Health is a commercial stage pharmaceutical company focused on developing novel, sustainably derived gastrointestinal products on a global basis. They operate in two segments, human health and animal health, and they have a fully owned subsidiary, Napro Pharmaceuticals. They focus on developing and commercializing proprietary plant-based human GI pharmaceuticals from plants harvested from rainforest areas. And before I get into the catalyst, just a quick background on their drug Mytesi. It's a product of Napro Pharmaceuticals, which is an oral plant-based prescription medicine approved by the FDA. The active ingredient is Profelemore, and it's a drug extracted and purified from the red bark sap of a tree in the Amazon forest. The indication is for the symptomatic relief, not treatment, of non-infectious diarrhea in adults with HIV/AIDS on antiviral therapy. However, most would agree that currently sales aren't quite good enough yet as it has a relatively narrow indication. And the last thing that I want to say about Mytesi is that recently they did get a $6 million royalty fee. It is a step in the right direction for validation purposes, but it doesn't start for 18 to 24 months. Okay, so catalyst number 1. Jaguar Health is granted conditional marketing permission in Europe for their drug Profelemore. And what's important is that the indication is going to be much broader this time. It's going to be to treat post-COVID symptoms, specifically prophylaxis and or symptomatic relief of inflammatory diarrhea related to long hauler syndrome. And so what's long hauler syndrome? Simply put, it's a group of post-COVID symptoms, including diarrhea. And the next step after marketing permission is granted will be for development and commercialization, and the potential patient population is going to be in the tens of millions. And per their CEO, Lisa Conte, it's estimated that as high as 1/3 of COVID-19 infected patients develop chronic episodes of long hauler syndrome. So clearly this is going to be a huge catalyst. All right, so moving on to catalyst number 2, that's going to be an update and or results on the Profelemore phase 3 clinical trial. This clinical trial is important because it's for the broader indication of prophylaxis of diarrhea in adult cancer patients receiving targeted therapy. And because the indication is broader, there's going to be the potential for a massive growth in sales if this clinical trial goes through. It's a 24-week trial, so that puts us around March 7th for either an update or results. And per the CDC, 650,000 cancer patients per year in the USA receive chemotherapy as an outpatient, and a significant proportion of those patients experience diarrhea. And diarrhea has the potential to cause dehydration and infections, so like I said before, the potential sales could grow this company significantly. Catalyst number 3, Jaguar plans to license Profelemore to a European subsidiary of Napro Pharmaceutical called Napro EU. And after that, there's been a proposition that they may be acquired by a SPAC, the Post-Pandemic Recovery SPAC. And if this actually occurs, the parent company Jaguar will obviously benefit. And from my understanding, there's been no additional news since the original press release, so if anybody hears anything, please let me know in the comment section below so everybody can see. And catalyst number 4 is going to be an update on the preclinical study initiated on January 6th of this year. It's a preclinical toxicology and safety study in dogs beginning January 6 to support the development of Profelemore, which is a plant-based drug candidate for Napro Pharmaceuticals that diminishes secretion. And so the potential indication is going to be symptomatic relief of diarrhea in dogs. The results should be coming any day now, so if I do hear anything, I'll put it in the comment section below and pin it. And to be fair, there are risks associated with a company like this that does not have significant sales yet. They do have continued operating losses and net losses, so there could be future capital raises even if one or more of the catalysts occur. And full disclosure, I do not currently own shares of Jaguar Health like I said before. However, if it was me and I did own shares, I may consider holding until at least to mid-March to see if one of these catalysts come through. And one more thing, I know there's other catalysts out there that I did not mention, so if you know of any, please let me know in the comment section below so everybody can see. And that does it for the video on Jaguar Health. I'm looking forward to your comments in the section below. I hope you found it informative. If you did, please consider subscribing and hitting the thumbs up. I greatly appreciate it. Have a great rest of your day, everyone, and I'll talk to you soon. Take care.